Good morning, all. I'm Jenny Probstel with the County Executive's Office. Thank you for joining our weekly press briefing today. This morning, we're going to get started with remarks from County Executive Pittman.
Good morning. Thanks for joining us. So let's start with COVID. Looks like case rates are holding close to steady for the last week, about 22 and a half, a little bit higher than last week, but not much. But the hospitalizations from the most recent rise in cases is shown up. So we have had an increase in our COVID patients in the hospital, but not a large increase. And I just have to say that while I think it's generally acknowledged that the opening across Maryland might have been a little premature, we still believe that we are winning the race to herd immunity due to primarily the vaccine supply and distribution work. So we've vaccinated 76% of residents over 65 in our county, and we're ready to move on. We welcome the governor's announcement that all residents over 16 are now eligible for a vaccine. So that will take place at all of our sites. But I want to discuss a shift in the strategy that it reflects a shift in the supply-demand ratio of vaccines to folks who want them. So pre-registration was a key to launching the vaccination effort when demand exceeded supply. It was an alternative to the vaccine surfing that folks were having to do in a lot of jurisdictions, and it allowed us to get the most vulnerable residents vaccinated first through our pre-registration system. But at the same time, our team at the Department of Health knew that as supply caught up with and eventually exceeded demand, vaccination strategy would need to shift, and that shift begins today. So as of today, we are no longer adding names to the county's pre-registration list. Instead, when you go to aacounty.org/COVIDvax, you will see direct links to appointments to registration, to register for appointments. So we've removed a step in the process to allow direct access to all of our sites from one web page. So you go to the site, and you'll be given first the option of a link to the state mass vaccination site at Navy Stadium, or a list of our locations and appointment times. And these will be updated every Tuesday at 7 p.m. and Thursdays at noon. All the pre-registrants that are still on our lists, including those who've been offered appointments already but have not scheduled, which is a significant number of those folks, are being offered vaccinations at the Navy Stadium site. So we've shared that list with the state, and they will be contacting those folks directly. So we continue to publish our COVID weekly report that also includes links to all of the known vaccine providers in our county with their current state allocations. And we encourage people to use that as well. The community vaccination clinics at churches and community centers continue to be an essential component of the strategy. These organizations deliver the trust and the convenience that we're absolutely going to need to reach the folks that have not already gotten in line for a vaccine. So Dr. Kalyana will talk more about the vaccination strategy, but we are entering a new era in that work, and it's exciting to see. I want to quickly congratulate the General Assembly and the governor on a state budget that really does deliver for the people of our county. We had no less than 20 local bond initiatives funded this year, sponsored by various delegation members, plus another 17 capital projects funded from the governor's budget, and additional projects that were written in by both the House and the Senate. And a great example, the one that I'm probably the most excited about, is having got a call at the very end of the process from leadership asking if there was anything else that significant projects that we would like to add to the list. And our Severn Intergenerational Center, which will be the first real community center in Anne Arundel County in a very, very long time to be built, was $2 million short of what we needed to be able to get that funded fully. And so that $2 million got into the budget at the last minute. So we're very excited about breaking ground on that Severn Center next year. Last night at the council meeting, I was really pleased by the passage, particularly of Bill 2521, raising our revenue reserve fund limit to 6%. It's currently at 5%. We transferred 1.2 million into the fund as a result of last night's action as well to get us to the 5% level. And as we're working right now on the final decisions on the budget that will be going to the council on April 30th, you will see that it's the kind of budget that not only delivers for today, but that sets us up well for the future with reserves and potentially sets us up to actually improve our bond rating for the first time in a very long time. I'm also thrilled that the council passed a resolution to give the Pascal Crisis Stabilization Center a 15-year lease at Crownsville so that they can continue improving the property and know that they'll be secure there. And then finally, there were a lot of amendments passed last night to Plan 2040, our general development plan, which is exactly as we expected the process to play out. Council members supported one another, local courtesy on land use designation changes that we had actually, many of which we had recommended for the regional planning process that takes place at the community level. Residents should really pay special attention, particularly to this next council meeting, which is likely to be the last where amendments are introduced. We expect some of the most controversial amendments to the plan to come near the end of the process. And I particularly encourage people to read the 25 pages of comments from NAIOP, the commercial builders. They make a case that diverges from the plan that we have set forth in Plan 2040, arguing that the county should incentivize development rather than place restrictions on it. And I've read the document thoroughly, and they make a strong case. It's a conversation that I think this county needs to have, and there are some suggestions in there that we are likely to adopt, but not the overall tenor of what they're proposing. And then I want to mention that today, I believe ACDS, Arundel Community Development Services, is putting out a press release calling on landlords and really working hard to reach landlords, encouraging them to take advantage of the federal ERAP funding for eviction prevention. We've got 17 million coming to the county and another 5 coming through the state to the county, in addition to the 5 million that we've funded ourselves. And we really do have lawyers and counselors that are working hard to get these deals put together between landlords and tenants. And while it's wonderful that the federal government has extended the moratorium on evictions, the CDC moratorium, landlords can still evict for failure to renew leases. And when they do, they lose any chance of recouping the losses that they've had. So we really do think it's in the interest of landlords as well as tenants to contact ACDS and take advantage of the program. And finally, I just want to say that I am thrilled that our libraries are going to be reopening in person on Monday, and thrilled also that our senior centers are in the process of putting their plan together to get seniors back into our senior centers. We'll have an announcement about that process coming up soon. So I guess over to you, Dr. Kalyanarama.
Thank you, County Executive. Start with the data. We're seeing that, yes, our case rate is pretty flat, hovering in 21, 22 over the past week. Certainly not going up is a good thing. We do want to see that go down though. We've seen our hospitalizations tick up slightly, particularly our acute care. We've seen a little decrease in ICU occupancy, and that's mirroring trends at the state level. Largely, we think because the median age of who's being hospitalized is decreasing. We have seen that there's been a decrease in hospitalizations in those over 80, and an increase in the 30 to 50-year-old age group. That's a reflection of the effectiveness of vaccines, right? We've targeted the older adults first as part of our vaccination efforts. And we're seeing those results in decreased hospitalizations. But we're still seeing that with increasing activity with a younger population, they are getting hospitalized. They are more likely to survive, but there are health consequences of that. So we still want to urge caution for folks, particularly those who haven't been vaccinated yet. We're seeing that our percent tested is about 2.6%, comparable to last week, which was a 2.7, but our percent positivity is increasing. It was at 6.5 last week. It's 7% this week. So that is suggestive fact that there is still continued spread. And we do want to encourage people to get tested, particularly if they have symptoms or have had any high-risk exposures, even if you've been vaccinated. While you may be okay, we don't want you to be spreading that to others who haven't had the chance to be vaccinated yet. In terms of our vaccine numbers, 30% of the population have gotten at least one dose. That's fantastic. It's about 172,000 people, but that still means there's a lot of people who have not had the chance to be vaccinated yet. And so it is certainly welcome to see supply increasing. The health department, we got 6,000 doses this week, pretty much the same as last week. But we're also seeing additional pharmacies, primary care providers coming online in terms of being able to vaccinate, and that's really a critical part. Particularly primary care providers, we know that some folks are going to be more comfortable doing it as part of their routine care and talking to their doctors about this. And so that's a key part of the strategy. Of course, we and with the leadership of the fire department have been working on standing up the Navy site, state-sponsored Navy site that's due to go live next week. So that's critical. We've talked about this being a race against the variants. Variants are climbing in terms of the percentage of cases that they constitute in statewide, now at about 40 to 50%. And so it's critical that over the next couple of months, really we're talking the next 2 months, that people continue to remember to mask, distance, avoid gatherings until we can get enough people vaccinated. This isn't an open-ended, it'll end when it ends. We're really talking about 2 months to get the vast majority of the eligible population of adults to get at least a dose in their arms by Memorial Day. So please keep that in mind. As the county executive noted, now that there is increasing supply, we are really happy to be done with the pre-registration. We want to make it easier for people to get vaccinated, particularly as on the original schedule, we were opening up to phase 2C. That constituted about 90% of our pre-registration list. And so that's why we felt that it was a good time to go to direct appointments for people to pick their appointment time on the website and directly sign up, not need multiple links to do so. And now with the move towards phase 3, because of increasing supply, it means anybody can get an appointment when they want it. We are still going to prioritize equity along with speed. And so, as the county executive noted, we are sending our pre-registration lists to the folks operating the Navy site, so we can give those who are pre-registered an opportunity. We'll also continue to focus on those who are more vulnerable, those over 65, 16 to 64 with high-risk conditions and the intellectual and developmental disability groups. And we'll continue to use our pre-registration list to reach out to those folks to get them appointments. We will also continue to have telephone access to be able to get an appointment. That's the 410-222-7256. We do want people who have the ability to sign up online to do that, so that we can reserve our phone capacity for those who don't have either any or stable internet access or aren't able to use websites to sign up. But we still will be providing phone service. We, along the issues with equity, we put out a request for applications for our Health Ambassador project. And that is a part of our vaccine equity plan, where we are going to be investing $500,000 in community-based organizations to hire staff to work with communities with low vaccination rates. And that's based largely on census tracts, so breaking down our zip codes even further, and to work with Black and Hispanic populations to increase vaccine rates. Applications are due by April 15th, and we'll be making awards by the end of the month. We're looking to see a wide geographic spread for these CBOs that we provide grants to, so that they can do boots on the ground, reaching out to folks to increase vaccine education and vaccination rates, and that'll be critical over the spring and summer. I want to turn attention to opioids. We haven't talked about it as much as we might otherwise due to COVID. During the first quarter of this year, we saw 169 overdoses, and 40 of them are fatal. That's a mixed picture compared to the first quarter of 2020, at which time we had 208 overdoses. So we've seen a reduction in overdoses, but 37 of them were fatal last year in the first quarter compared to 40 this year. So a slight increase in fatal overdoses. And it's critical that we, particularly as we start to exit from COVID, that we redouble our efforts in this area. And so one of the things that we're really pleased with is our opioid grant, $925,000. It's going to allow us to do a few things. It's going to allow us to expand our media campaign around this issue. It's going to allow us to, with our crisis stabilization services, expand to people without an opioid use disorder. That's always been a challenge, is that these opioid dollars have been exclusively for those with an opioid use disorder, but we know that both polysubstance use and people with other substance use disorders would benefit from these services. Excuse me. It allows us to expand our judiciary training. We've been working with the circuit court, and we're going to expand to the district court. We can expand our peer support specialist services. And we're also going to be able to expand our recovery housing, particularly for women and women with children, and it allows us to continue our strengthening families programs and case management for drug court. I think key to this is that, as I noted, we're going to be placing a greater emphasis on dealing with other substances than just opioids. We are seeing that is a critical gap. As money has gone into opioids, that those with other substances maybe don't have the same treatment options anymore. And so we do want to address that. And we're also having improved data sharing between Annapolis and Arundel County, which I think will help us paint a clearer picture of what's going on throughout the county. And so with that, I will turn it over.
Thank you. Now we'll take questions from the media. If you could please put your name and affiliation in the chat, we'll call on you when it's your turn to ask a question. We'll get started with Danielle from the Capitol.
Hi, good morning. So regarding the new system of no pre-registration, won't this encourage sort of the Hunger Games effect that we've seen on other registration websites, where, the folks who are the most tech savvy, have the time, can click fast, are the ones that are going to get appointments?
Yeah, that's definitely one of the concerns that we had, but I think there's a couple of things that are changing. One, there's a lot more vaccine availability. The pre-registration was meant to avoid that bias towards those who are tech savvy, but we're seeing that it's taking longer and longer to actually fill up all our appointments. When we clean our pre-registration lists by comparing them to CRISP, we see that a lot of people are getting them elsewhere as well, which is fantastic. And we're also seeing a 7 to 10% no-show rate at our vaccine clinics now. Not turnaways, but no-shows. And so I think we're at the point where we're seeing that this move away from pre-registration, this is the right time for that.
And how many appointments are going to be released on those kind of drop times, 7 p.m. Tuesday and noon Thursday?
Yeah, we're still working out the details on how we're going to reserve it. Generally, we're going to do 3 days worth on that Tuesday drop, so the first 3 days of the cycle, and then 4 days worth on that Thursday drop. That's our general breakdown at this point.
And then these are still going to be at the county sites, not this.
Correct. These are for the county sites. We continue to be the largest provider of vaccines in the county, and so as we talked about, all other vaccine providers, fortunately, we all have our own methods. The state site is the state-sponsored site. The Navy site will have pre-registration available as part of it. And so there are still different rules between county and state sites.
Gotcha. Thank you.
I'm not seeing any others in the chat. I'll do a last call for questions from anybody else. Jace Cook from the Capitol.
Hello, this question's for the county executive, and my birds are upset today, so I'm sorry. Mr. County Executive, you had mentioned this about the GDP, and I know this is usually a COVID-focused thing, but you had mentioned that these were some of the things you guys had in the regional plan, some of these more, I don't want to call them spot zoning because that's not a thing you're supposed to do, but essentially small parcels that were being tweaked and changed by the council members. You're talking about local courtesy. Was there anything in there that you saw that was a major concern? And there was some discussion. This is a two-part question. Sorry, guys, seriously. Was there any concern about the questions on the validity of the regional plans moving forward? There was some confusion about how those would be implemented in GDP in future revisions 8 years from now.
Well, I mean, we knew that the regional plans were controversial because they postponed the actual rezoning. So these are land use designations, and the staff at OPZ was careful not to make big decisions about land use in that. And if communities in their regional plans wanted to identify areas where they were going to recommend rezoning, we left that controversial work, some of that, to those regional planning bodies. And so I think what some council members may have done is jumped ahead and said, well, we want it done now. We want to get the land use designation changed now. That doesn't change the zoning yet, but it sets it up for it. And I think those are the cases where you saw the administration not supporting some of those decisions. I haven't heard that any of them were major changes to the overall picture that we're trying to create in the county. And I think there were a couple that we supported as well. So it's just it's just my message to residents is watch this process, because things can change quickly and there's one more meeting. It'll be interesting to see what new amendments they come up with next time. But it's working as it's intended to. I mean, the council is supposed to have a voice in this, and they have, and they're taking their job seriously, and I think being responsible about it.
Well, thank you, County Executive. And so just one other question real quick. I know there was a resolution introduced last night calling on the police trial board hearings to be live streamed. Obviously, that's probably a discussion between you and the chief. Any movement on your side about doing that?
So, I mean, I've said from the beginning on this case that I wanted it to be as transparent as possible, and I would actually prefer for the hearing to be live streamed. I think it would be a positive thing that transparency heals like sunshine, and that people want to know, what happened, and they want to be able to observe this process. And the challenge is that, we're told that if we announce that we're live streaming this, then it most likely goes to circuit court and the whole thing gets slowed down. And I believe that we need to move forward and get resolution. I think people want this hearing to happen. So we don't want to get into a court battle over this. This is most likely the last hearing like this under the current rules, assuming that the General Assembly comes to some agreement on what they want to do. And so we're not setting a precedent in any way here, because the rules are all likely to change. That was my initial position, was the same as Councilwoman Rodvian, and I talked to her extensively about this, and I respect her decision to bring this before the council, to have this public conversation about it. But we're in a place where we really don't want this to end up in the courts and get this whole thing bogged down. So we're not going to live stream. We've identified the locations where it's going to be where people can view it, and that's the way we're going to proceed.
Thank you, County Executive.
Next, we'll hear from Rob Lang with WVAL. Rob, are you with us? If you could go ahead and unmute yourself.
Now I've unmuted. You can hear me okay, right?
Yes,
Yeah.
thank you.
All right, my apologies. So with the registrations, the appointments, that is strictly the county sites, just to clarify, that will not apply to the Naval Academy site opening next week, correct?
That is correct.
Okay. The second question, and Dr. K, I'll give it to you, but also to the county executive. Do you get the sense, now that Maryland is moving to phase 3, that anyone who'll be able to get a vaccine who wants a vaccine will be able to get one? Or is there going to be a long waiting time?
Yeah, we're seeing that the waiting times are down drastically. And that's why access is opening up, both in terms of the pre-registration and also who's eligible. So we really want to make it as easy as possible for folks to get vaccinated now.
Fair enough. Okay, thank you very much.
And we have one last question from Chase Cook at the Capitol again.
This question is for Dr. Kalinaraman. This is actually kind of piggyback on that last question, but you mentioned the no-shows and the fact that we are increasing eligibility. Is there a gap with hesitancy? Like, are we seeing a gap in need, or is that demand still there no matter, even with the hesitancy and the no-shows?
Yeah, I think we're, in this month, we're going to be switching, I think, conceptually from meeting the demand to doing more persuasion and outreach and getting folks. We talk about 30% have gotten their first dose. That amounts to over 40% of adults, putting aside kids for a second who are not eligible at this time. And historically, what we see with vaccination rates is that once you get to about 50%, you have to start working a lot harder to get folks on that second half of the population. And that's really where we're headed in April. And so that's going to be a cornerstone. We talk about hesitancy, we talk about demand. Well, supply has met that demand or come close to meeting that demand. Now we're really talking about people who have questions, hesitancy, or maybe just haven't prioritized it. So that's what we're transitioning into, is reaching out to those folks. That's what the Health Ambassador program is about reaching folks. And that's what all these changes are, to increase access.
I lied. I'm sorry. One last question off of that. Is there going to be a problem with long-term storage once you see that shift from there being less demand than there is supply? Does that question even make sense? I'm sorry if it doesn't.
There's not really going to be a problem with storage. We're just going to have to calibrate how much we actually need to order. All vaccine providers we're probably going to switch more to ordering what we need as opposed to getting an allotment. And we'll certainly talk about when that shift happens for us as a provider when we start seeing that throughout the county.
Thank you, Doctor.
Thank you. Seeing no more questions, that'll conclude our call for today. Thank you all.
Everybody.